COVID-19 has impacted each one of us in different ways, but we've all been affected. The only way to protect Middle Georgia and each other is by working together and taking all preventative measures outlined by the CDC. Here's a few tips to prevent COVID-19. Wear a mask. Wash your hands frequently. When you cough, cover your mouth. Don't touch your eyes, nose, or mouth. Avoid contact with sick people. Also, clean and disinfect to keep you and your family safe.
We'll need your help, and this will help everybody get through COVID-19.
For updates on changes in Macon-Bibb, government services, and office hours, visit maconbibb.us/COVID-19. And let's protect Middle Georgia.
We will get through this with hard work and long hours, by keeping our distance while keeping in touch, by traveling less and moving more. You do your part by staying home, and we'll do our part to keep the lights on, providing you with reliable energy and giving you more ways to use it efficiently. We know home means more now than ever. Count on us to be here so you can be there.
Haversham, publisher of the Macon Middle Georgia Black Pages. The way to be in the know and know what's going on in our community is to join our mailing list. Go to our website, www.maconblackpages.com, and join our mailing list, and then you'll know what's going on because you'll be in the know. Join today.
www.maconblackpages.com.
There's an old saying that says an ounce of prevention is worth a pound of cure. And oftentimes there are things that happen to us and we're kind of aware that we should kind of take a different action, but we kind of neglect to do so, and later on we're sorry. I remember a long time ago when I was a younger boy, I used to shoot marbles. And I hope that you're familiar with what shooting marbles mean. But anyway, if you made a mistake in shooting marbles, you could just say slippers. And slippers would, saying that word would erase the mistake. But that's not true for certain other factors in life, particularly as it relates to health and well-being. And most specifically, since that's what we're going to talk about today, is as it relates to cancer. And I'm sure that all of us are familiar with that dreaded disease, how in one way or another it has affected everybody, either personally or through a relative or what have you. So I'm just so happy to have with me today Dr. Symmes Johnson, who's a gynecological oncologist. I told her I couldn't pronounce it, but I think I did all right with it. And we are going to talk about cancer. We're going to talk about the big C. We're going to talk about the dreaded disease, and we're going to kind of emphasize cervical cancer a little because January is Cervical Cancer Month. But we want to talk generally about cancer and the different types and the causes, prevention, diagnosing it, etc. How you doing, Dr. Johnson?
I'm doing fine, Mr. Haversham. Thank you for having me.
Yes, ma'am. Thank you for coming. Tell us a little bit about yourself generally before we get into the specificity of cancer.
Absolutely. Well, I'm from South Carolina, but I went to undergrad at UGA, which is how I ended up back in Georgia. I did all of my training in Kentucky at the University of Louisville and the University of Kentucky, and then hurried back south where it doesn't snow. So I've been in Macon for a little over 2 years now, practicing gynecologic oncology.
Okay. Now, let me tell you something that I've heard, and I wish you would address this. You got some smarties saying that, well, if they could come up, and then this is really a problem on the part of some people, because they are saying that if they could come up this quickly with a vaccine for COVID, why haven't they come up with one for cancer? So, I mean, I know that no one has come up with one, but can you address that?
Yeah. So actually, there is one vaccine that prevents cancer, and it's actually the human papilloma virus vaccine. So that virus is the known cause of not only cervical cancer, but also vulvar cancer, vaginal cancer, and penile cancer. So
Wow.
important for both boys and girls to get that. It's important though that they get the vaccine before any type of exposure to HPV, which is why it's given to adolescents.
Right. Now that
Now,
is so good to know. Go ahead. Go ahead.
oh, I was going to say, now, as far as other vaccines for other cancers, unfortunately, they're not usually caused by a virus or bacteria. So trying to find the genetic makeups of the cancer that we can develop a vaccine for that doesn't also attack the normal cells of the body has been difficult, but certainly clinical trials are ongoing.
So there's a difference in the technology. There's a difference in what the vaccines are trying to address, etc. But I am very, very glad that you have informed me that there are vaccines for certain kinds of cancers.
Yes, sir.
That's very, very good to know. And let's talk a little bit about, the causes and the prevention of the specific kinds of cancer. Now, are there certain common actions that could cause people to get a specific kind of cancer, or do certain behaviors kind of contribute to one's catching contracting cancer in a specific area or generally? If
Yeah,
that makes sense, if that question
it
makes sense.
does. Yeah. So I would say, in general, bad habits and bad health promote cancer. So smoking, obesity, um, alcoholism, those like bad habits and decreased exercise promote cancer kind of in general across the board.
So,
Now,
so it doesn't have
it's
to be addressed medically. There are just some things that one can do in everyday life that can kind of enhance or increase one's ability to fight off or not catch cancer.
correct. Yes. Yeah.
Yeah, that 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 is really, really good to know. Now I just noticed, I mean, there are literally dozens of different kinds of cancers, and I guess that means that one can catch cancer basically in any part of his or her body. Is that what it's?
That is true. You can get cancer everywhere.
Yeah. And then just kind of, what's a quick and dirty explanation of what cancer is and what happens and how one catches it?
So, cancer is the abnormal growth of normal tissue. Means that that tissue grows a lot faster than you want it to grow, and because it grows fast, it starts to do things that it's not supposed to do. Now, you can get cancer a couple of different ways. One is bad genes. It can be passed down in the family based on some type of abnormal gene that's carried down. The other thing, of course, is bad habits, as we've already discussed. And then the third thing is bad luck.
Yeah.
Sometimes people's genes, not in the family, but just in general, will mutate, or something will cause them to change in such a way that causes cancer. And a lot of times we don't have a reason.
Okay, now explain the relationship between going to the doctor and getting exams and the ability uh, to cure and or fight off cancer.
Well, absolutely. So going to the doctor is a good thing because doctors know early signs of cancers, even funny things that we don't think of general everyday. There are some fluctuation in where you've gained weight. Is it around your belly? Is it in your legs? And that can kind of clue them into an early stage cancer, which allows for early screening, catching something that can potentially be cured.
Okay, let me ask you this. So, what are the medicinal signs, other medicinal signs and approaches to diagnosing cancer? Uh, other, like can a blood test kind of give
Oh,
an
sure.
indication?
So different types of cancers can be diagnosed different ways. Some of them you can do blood work, and the change in that blood work can mean a cancer. Sometimes it's an X-ray or some type of imaging, like a chest X-ray can sometimes see lung cancer, or a colonoscopy can see colon cancer. Um, for some things, unfortunately, there's not a lot that will tell us you have cancer until you really show symptoms that say, hey, I think this person needs a CT scan, and the CT scan would show a cancer.
So, I guess it's very true, and you can talk about this if you would, that the earlier it's detected, the more possible, that you can have positive treatments that could result in longer life or cure or what have you. Talk a little bit about the importance and the significance and the impact of early detection.
Sure. So all cancer comes in stages, and you have a stage 1, which is the earliest, and it goes all the way up through stage 4, which means it's spread to other organs in the body. And really, stage 1 cancers are cancers that are small enough that they can be either treated surgically and completely removed, or treated with other medications, including chemotherapy or even radiation. But those tumors are still small enough that the chemo or the radiation can penetrate it completely and not only take care of the tumor that's seen, but also any of the microscopic or the disease that's hidden around that tumor. Um, once that microscopic disease kind of spreads all over in the later stages, it's much harder to treat than when it's confined to one space.
Okay, now you said that there are vaccines for cancer, but are there shots that one could take? And I guess that would the chemotherapy be like a shot, to treat the cancer? Are there other like injections that one can use or that are used, to kind of fight cancer? Because a lot of people don't understand the relationship and the difference, and when the decision is made as it relates to whether one should use or get chemotherapy or radiation.
Sure. So there are shots that are used to treat cancer, actual like injection into the muscle shots, but also shots of medications that go through the IV called chemotherapy. We also have newer treatments called immunotherapy, which I think are most similar to vaccines in that instead of attacking the cancer, they rev up your own body's immune system to be able to fight the cancer. And those are really big, not only in clinical trials right now, but as leading edge therapy for especially my kind of cancer, like the ovary and the endometrial cancer, showing really good results.
Yeah, I noticed that. Before I go on to the types of cancer that are most prevalent in males and females, let's talk a little bit about, breast cancer.
Okay.
I noticed in doing a little research that it showed how many women have breast cancer, and then it also had men. And a lot of people don't realize that, and I think it behooves us to at least mention the fact. You can talk about women first, and how to detect it, and maybe some of the treatments, but I think it also needs to be mentioned that men can also catch breast cancer.
So women, of course, are lucky because we have screenings, right? We have mammograms, which can pick up very small early tumors. But to be very honest, the best thing a woman can do is to know her own breasts and do self exams, because it's most commonly the patient that notices that there's a new nodule or something on an exam, or that they feel that prompts them to come in and gives that diagnosis. Um, with women, of course, it can be genetic, meaning passed down through the family, or it can be a spontaneous cancer diagnosis. And of course, they're all treated a little differently based on some of the hormone receptors and other DNA testing that they can actually do of the tumor. Now, men, on the other hand, of course, can get breast cancer, and we don't really have screening for men. No one thinks that, oh, they need mammograms, although all men have two breasts. Um, with men, it's a genetic component, though. Very rarely is male breast cancer spontaneous. So, by genetic component, I mean that that man's mom, grandma, sister, aunt, other people in the family had breast cancer. And a way for those men to be aware and to have early detection is to have genetic testing done, or to make sure they know that a family member's had genetic testing done, and what abnormality they had, to see if that guy is more susceptible to getting it.
So it seems like I'm hearing you say that it is absolutely advantageous to know kind of like uh, the medical or medicinal, however you pronounce it, history of their relatives, like their mother, their father, and other family members. So how do you suggest that one keeps up with that? I mean, I think oftentimes we don't think about it. Take for example, my mother. I've got a mother and a brother, frankly. Who died of colon cancer, and then my father, he lived to be almost 90, so I don't guess he had anything too prevalent. But I guess what I'm trying to ask is that should one be interested in trying to learn what happened to his or her relative as it relates to the kind of sicknesses they had, illnesses or what have you before their death?
Yes, I think that it's very important that you know your family history and find out, not only what may have caused a death, but what other kind of illnesses did people in your family suffer from. I think in the past people have been very hesitant to talk about medical conditions. I think now and moving forward, people are becoming more aware of how important family history is in what type of diseases or what they can expect in their life. So people are a little bit more open to talking about it and sharing information with family.
Well, I think a good case in point, and I hate to be personal, but I guess when my mother passed of cancer, then that should have been a signal to all of her children and her relatives, that we should get colonoscopies
Hmm.
and get checked for it. Because a few years later, maybe 10 or 12, I don't remember exactly, it happened to my brother, and he too passed from colon cancer. So, but you were suggesting, and correct me if I'm wrong, that had he taken that as a suggestion or a signal and started to kind of have that test, then he may be alive today.
You know, um, I think that he certainly may have been able to catch it sooner, especially if his physician is aware of that family history, and that puts him at a little higher risk. Um, it's tough when you just have one family member that has a cancer diagnosis, but especially for you, now that you have two family members, it's even more important that you know, you get your not only you get screening more frequently than those of us who don't have colon cancer in your family, but also you figure out, hey, I've now got two people. Is there also some type of genetic component or something that I may have in my genes or even can pass down to my family that may be the cause of this?
Okay. Well, I did, I did go and get tested, and I think it's suggested, and maybe one should do it more often when, in fact, there's a family member who suffers from any kind of cancer to kind of get tested for it. But I think that the suggestion at the time was every 5 years. It's been about 3, I think, and then maybe I'll bump it up a little bit and get tested a little earlier. Now, is leukemia a form of cancer?
So leukemia is a form of cancer. Leukemia is a cancer in the blood. So a little bit different than, you know, these other cancers we've been talking about where you can actually see a tumor. The leukemia you can't see. But it certainly does show up on your blood work.
Yeah, yeah. So uh, there are so many different kinds of cancer, and I was just blown away, in trying to do a little preparation for this interview as it relates to the different kinds. So just kind of, if you would, walk us through, a person who is concerned about, whether or not he or she has cancer as it relates to what kind of testing they should do. Then if in fact that person finds out that he or she is diagnosed with cancer, then what should we just kind of be aware of as it relates to testing, and then as it relates to prevention, testing, and then treatment? You kind of talked a little about prevention,
Mhm.
but you can kind of go over that again if you would.
Sure. So I think with the first thing with prevention is making sure that you see your primary care doc at least once a year because they always do a good exam, but then they also draw routine blood work, which can be show early signs that maybe something's going wrong. You know, of course, that would prompt additional testing. You know, not only that, but of course, getting recommended screenings as per the you know, U.S. Preventive Task Force. Um, you know, mammograms, colonoscopies, Pap smears for women. You know, PSA testing, those kind of things. And then I think the other thing too is kind of being aware of your body. You know, if something is changing, you know, you start to feel fatigued, you start to see some random bruises, you start to have blood in your urine or blood in your stool, or just things are not what they used to be, then of course see a doctor because that will prompt some additional studies that may help us diagnose early.
Right. Well, we don't want to quit. I mean, time really flies when you're talking about useful information.
Yeah.
So take about a minute and talk about cervical cancer and mention the detection, prevention, and treatment of that very quickly.
Sure. So cervical cancer is higher than it should be still in America. It's the leading cause of death actually in third world countries. But in America, we have Pap smears, which are excellent tools for cervical screening. Every lady should get a Pap smear. So I will tell you this as an oncologist, I think every lady should get a Pap smear every year. However, guidelines say that you can get a Pap smear every 3 years as long as they're normal. Um, a Pap smear shows cells that may be early signs of cancer. It means they haven't become a cancer yet. And because they haven't become a cancer yet, they can be treated and you can make them go away completely. By getting early treatment and making these precancer cells go away, you significantly decrease your risk of getting a cancer.
Wow. Wow. Well, that's outstanding. Well, Dr. Johnson, I really gynecological oncologist. I'm really happy that you've been able to spend this time, and it's been phenomenal that you have shared this information with us, and I'm sure that it's beneficial to everybody who listens to it or see it. This is a call to action. I'm your host, Alex Habersham, having interviewed Dr. Symmes Johnson, who's a gynecological oncologist with Navison Health. Thank you so much, and the information has been very, very fruitful and phenomenal. Have a great day.
COVID-19 has impacted each one of us in different ways, but we've all been affected. The only way to protect Middle Georgia and each other is by working together and taking all preventative measures outlined by the CDC. Here's a few tips to prevent COVID-19. Wear a mask. Wash your hands frequently. When you cough, cover your mouth. Don't touch your eyes, nose, or mouth. Avoid contact with sick people. Also, clean and disinfect to keep you and your family safe.
We'll need your help, and this will help everybody get through COVID-19.
For updates on changes in Macon Bibb, government services, and office hours, visit maconbib.us/COVID-19. And let's protect Middle Georgia.
Hi, this is Alex Habersham, publisher of the Macon Middle Georgia Black Pages. The way to be in the know and know what's going on in our community is to join our mailing list. Go to our website, www.maconblackpages.com, and join our mailing list, and then you'll know what's going on because you'll be in the know. Join today.
www.maconblackpages.com. If you need a little help paying or reducing your energy bill, Georgia Power is here to help. If you're 65 years or older living on a fixed income, Georgia Power has a senior discount you may be eligible for. We also have lots of programs and services that can help you reduce your energy use. It's just one of the many ways Georgia Power is committed to helping customers save on their energy bills. Call us or visit georgiapower.com/energy assistance.